Good morning. In life, I try to be as even-tempered and respectful as possible, whether I'm talking to people or filming a video. But there's one topic that really gets my ire up, and whether I'm speaking to clients or having gone through it myself, it's medical care in the Bureau of Prisons. I remember in the first week when I was at the camp in Miami, I met an older gentleman, relatively older to me. I think he was in his low 70s. And he was telling me that he's being forced to wear diapers. And when I asked why, he explained that he had had prostate and bladder surgery, and he needed a catheter. And he had been at the camp for the better part of about almost two going on 3 months, and they hadn't gotten him a catheter yet, which means he was forced to wear diapers 24 hours a day. At that point, I started learning how mismanaged and poorly equipped the medical care is within the Bureau of Prisons. You see, in the Bureau of Prisons, there are 4 levels of medical care. There's level 1, which is typically what you see in a camp, and it has to do with the distance to a major trauma or medical facility, up to a level 4, which are your federal medical centers. There's a handful of those. However, due to tremendous understaffing and budget shortages, the BOP is just not equipped to deal with the medical issues of an aging population. And whether it's trying to figure out what medications you might need, or even seeing a doctor, again, at the camp in Miami, we were attached to a low security facility. So there were about almost 2,000 inmates. There were 2 doctors for all 2,000 inmates. And those 2 doctors only worked 2 days a week. So by the time you actually saw a doctor, if you had a problem, it could have been a 2 or 3 week delay. When preparing to go to federal prison, I like to tell people, have every possible checkup you can. Go to your medical doctor, get your annual checkup, go to your dentist, get your teeth cleaned, go to a podiatrist, go to an eye doctor, because you're simply not going to get adequate care in prison. And while you might get there and put in for requests and do your best to see somebody, if you're lucky, maybe you'll see a physician's assistant. And getting medication is also critical. I always tell people, bring a 30-day supply of whatever medication you're on in the original container. That's not to say that you'll be allowed to take it in, but some institutions are a little more lenient in what you're allowed to take in, or at least it'll give the pharmacy at the institution additional information about the medications you're on. And if you're currently on a medication like a tranquilizer, a mood stabilizer, Valium, Ativan, or something like that, because you're going through the process and you're nervous, you haven't surrendered yet, word of advice, start weaning yourself off, because you're not going to get that medication in prison. And there's nothing worse than going through withdrawal in prison. To sum it up, being sick in prison is a horrible thing. Do your best now to be prepared for what's in front of you. If you have any questions, look at the blog that's associated with this. Give me a call. I can discuss the BOP formulary and the nuances of what you and your family need to be prepared for as you enter this unknown world of the Bureau of Prisons. Thank you.